Tēnā koutou, and thank you all for coming to our third seminar for the 2024 Compass Seminar Series. Today we'll be hearing from Paula Araya-Herrera, who will be talking about motor development trajectories for children with autism. Paula is a physiotherapist and researcher in the Applied Behaviour Analysis program at the School of Psychology. Her doctoral research involves exploring the associations between gross motor and other developmental areas for autistic children and the implications for practitioners. She uses quantitative methodologies to examine these effects from population evidence and practitioner perspectives. With that, I'll pass over to Paula.
Thank you very much, Natalia. So welcome, everyone. Thank you for coming today. I know it's a rainy day. So today we have an invitation to understand a little bit more about gross motor developmental differences between children with and without autism. We currently know a little bit more about social communication and behavioral difficulties that have been commonly studied in autistic children. However, the motor development, still there is a little more that we can research about. So this is my invitation for today. A little bit about myself, just to start. I'm a physiotherapist. I work in autism and also neurodevelopmental difficulties. I'm part of one of the thinnest and longest country in the world. I come from Chile, and I work from 12 years ago at one of the most diverse public universities in my country, which is the University of Valparaiso. I also have been training motor development in children, neurotypical children with developmental difficulties, and specifically motor developmental difficulties, and most recently autistic children. And that were part of the program called Chile Grows With You. But after a couple of years that I started to have more and more questions about autism, and I realized that my clinical experience was not enough, so I need to move forward into research. So if you know that childhood is important, consider the timeline between you were born until before 18 years old. So if you compare these two brains, you will see differences in the in the gray matter for the most developed and aged brain. So a lot of changes happen during childhood. And also, if you're more specific about early childhood, is the time between you're born and 8 years old. So for New Zealand, it covers both infancy and kindergarten, and also year 1, 2, and 3 from the primary school system. So these three different processes of development happens at the same time during early childhood: physical development, cognitive development, and social emotional. However, the physical development is the one that is more relevant, as it could open another window for learning opportunities in very early stages of age. So we know that in the frontal lobe, this structure is the most responsible for motor control, for reasoning, for communication, for emotion at the same time. So this structure is the one involved for execution of movement. We also know that there is some specific pattern for development motor skills, is from the head to bottom, and also from the axis to out of the body. This way, we ensure that the large muscle groups are first developed. Just remember that large muscle groups are the ones that are thicker from our thighs, our arms, and at the same time, they're able to sustain in time exercise, are better at fatigue. On the contrary, those muscles are more small, more thin, like on your fingers, for example. They're very good at execution. However, they're not good at sustaining movement for a long period of time. So it makes sense for me to first develop our large muscle groups to perform like walking, running, and other gross motor skills. These are the gross motor skills that we'll be talking about today. So in the transitions from motor play to focused learning, it happens without any notice, very fluent way during early childhood period. However, we do know this motor development could be an open window for other learning opportunities. Now, what do we know about autism? So we know that it's a neurodevelopmental condition that is affected mostly communication, social, and repetitive behaviors, and repetitive and restrictive behaviors. We also know that the prevalence has increased in the recent years. We know that currently 1 in 36 children are affected by this condition, and at the same time, 85% of them mostly will present at certain time of comorbidity. Could be psychiatric comorbidities, motor difficulties, cognitive, behavioral difficulties. The thing is, there's a vast amount of information about communication difficulties, how we do the interventions for communication, how we provide the most effective intervention for behavioral difficulties. However, motor training and motor development has not been a part of the research, and so far in the exact level of depth information. And also, we don't know that we currently know that it's not part of the autism criteria as well. So maybe we should also focus on this part of development at the same time. Particularly in Aotearoa here in New Zealand, we do have two important studies. One is from Nicholas Bowden on IDI on 2020. So all the kids that access to hospitals and access to any kind of specific service, specialized service, all this information was collected, and he was able to identify younger kids of 9 years old, about 5,000 kids. And also the rate of identification was 1 in 102. Most of them were males from European mothers. And at the same time, it was quite diverse in terms of cultural backgrounds. The other study that was important is the one from Matthew Eggleston, who provided information about how difficult it is to achieve an early diagnosis here in New Zealand. So we currently know that the age of autism diagnosis is about 8 years old. We also know that all the parents who are pursuing the formal autism diagnosis take about 4 to 5 professionals to actually get to the appropriate professional to be assessed, and also about a 5 months waiting list to get the assessment. So due to aforementioned comorbidities, we do have some delays in gross motor development, but how is it different to children without autism? We do have a couple of research so far. Most of it is related to the type of interpretation of the environment in terms of the time. Most signals will take longer time, other signals will take time to process information, and also time to execute the movement of the response. Also, we also see some differences compared to typical development children in terms of how accurate and precise is the movement. So there is this hypermetry in the movement. So my brain is saying that this object is a little bit away that it's actually are. So we see children that are more not so precise, they're not well coordinated. And that's the way we see that. But there's another physiopathological explanation for that. So there is some previous research that has been conducted in the School of Psychology at the University of Auckland. There is some research conducted on behavioral difficulties in autism, in cognitive development, and social emotional skills. But at the same time, there is no research about gross motor development, specifically using this covariates associated with developmental for child development. So that comes our research question: how similar or different is our gross motor developmental trajectories in children with and without autism when controlling for these perinatal health indicators and also social demographic factors? So we used the Growing Up in New Zealand data because we wanted to have this kind of diverse background. We have a large sample size, and also we could generalize these results and have a more statistical power. But at the same time, this data set also provides a quite diverse cultural in terms of socioeconomical backgrounds and cultural backgrounds. So all the main cultural groups were quite well represented in the sample. Also, the sample came from 3 district health boards regions: Auckland, Manukau, and Waikato, which represents about 6,843 children whose mother were expected deliveries from April 2009 and March 2010. So about our variables, what we wanted to see is according to time, first, the autism condition, second, the outcome variable or the criterion. If you're thinking in terms of our regression, our gross motor delay, and the age of the child by the time that data was collected. All by this, controlling by social demographic and perinatal factors. So the way that we created the autism variable, first, we look at all the F84 codes for the ICD-10 when the mothers were asked about any health or developmental conditions for the child at 24 months. We also asked the mothers at 54 months whether their child could be autistic according to their perception, or if they have confirmed any autism diagnosis. And the only time that we used the 8-year data collection way was to confirm whether the child was affected for autism, or if they have, what time was diagnosed for autism. So we end up with 3 different groups. The first group was autism diagnosis. So at 54 months, we consider the child had a formal diagnosis or at 8 years old. The autism concern groups were as mothers at 24 and 54 months or at 8 years old without having any confirmation of autism diagnosis before 8 years old. And all the rest of the children were considered in a control group for no autism, but also we have to make sure that this group also includes all the other conditions, like cerebral palsy, Down syndrome, any other kind of motor difficulties. We will see how we manage that in future. So what we wanted to do is have the information as early as possible. So we took the 9 months data collection wave and asked the mothers whether they replied to the answer to all the questionnaires related to gross motor development. Once we did that, we take all the not applicable responses in terms of the gross motor delay. So we end up just for now with 6,359 children at 9 months, at 2 months, 6,046 children, and then at 54 months, 5,831 children. Then what we did is what is kind of usual in the longitudinal study. We lost a couple of children in the follow-up. So it was about a little bit more than 500 children by the time of 54 months, but we didn't want to lose more children. So we replaced the data with simple series mean to all the don't know or refuse to answers at 24 and 54 months. Otherwise, we will end up losing another 700 children. So by the time we finally got our sample size for the 3 different groups, at 9 months, we got 800 and 186 for the no-autism group, 65 children at the autism concern group, and 108 children for the autism diagnosis group. If you see, we didn't see so many cases at the 54 months after in the follow-up. So when I was looking for the way to define which one of the items of the questionnaire were the most relevant to identify a total score for each data collection wave, I end up having 124 items. So the way that I decided to for which one of the items was more relevant for this total score, it was doing what previous study has been done by Dennis Newman, for example, using the World Health Organization report of 2006, specifically the one related to motor development study. So we used at 9 months that reference to identify which items will be selected. At 24 months, we use the Alberta Infant Motor Scales, which is an instrument to measure the quality of movement in terms of the base of suspension, the expression of movement. So it's quite explicit about the development in the expression of the scale. And finally, for those kids between 25 and 54 months, we use the 3rd edition of the test of gross motor development to identify the relevant items. So we end up with 8 items at 9 months, 7 items at 24, and 8 items at 54 months. We wanted to dichotomize this variable in terms of looking at, okay, these children were delayed, these ones were not delayed, or were achieving the expected development, the gross motor development. So we wanted to create a total score at each data collection wave. However, when we try to accomplish the assumption of normal distribution, we didn't. They were not normal distributed. So what we did is we used the set score. And by doing that, we standardize each total score for each data collection wave in terms of the gross motor performance. Now, we do have some differences between the time that data was collected versus the time that they actually had the child at that time. So that variation was about 2 weeks for 9 months. However, at 24 months was about 6 months. And at 54 months was about 18 months. So we know during early childhood time is very important. So what we did is we used the set score at 9 months, but we age adjusted at 24 and 54 months. We test again the normal distribution, and they were not again normally distributed. So what we did is I created a binary total score of gross motor developmental delay using one standard deviation below the mean, saying that 85% of the kids will have expected development, and 50% of them will have below the mean, like a delayed gross motor development. There is a number of variables that have been widely studied to be related to child development. The one we used was from the mother, age, educational level, deprivation index, and ethnicity. And from the child, we use sex, gestational age, birth weight, parity understood as the firstborn, the subsequent children in the family. So when we run the logistic regression to see where we found significant differences between the groups of children without autism and autism diagnosis, and we found that at 24 months was the earliest as possible that we identified these differences. And the good predictors at that time were the mother's ethnicity, the child's sex, and the gestational age. If we see here that the probability of gross motor delay in the 3 groups, we see that the bottom line is the group of no autism group, and the green line is the group of the autism diagnosis group. So if you see that at 9 months, there is not much variability or differences in terms of the 3 different groups at various stages. However, at 24 months, we increase and we see those differences. And after 24 months, the group of autism diagnosis experience a little decrease at 54 months. However, the group of autism concern, which our mother expected the child could be autistic, this group of children experience a continuous increase across time. We also did 3 chi-square tests to determine a binary relationship between the gross motor delay and the group of autism. And it was significant at 24 and 54 months. However, at 9 months was not significant. So that told us that 9 months were not a good predictor for later on difficulties. So we wanted to use another kind of model that could be able to embrace this kind of differences in terms of the regression, a retrospective study, but also to consider the differences and variabilities between each one of the participants across time and between the 3 groups across time, sorry. So if we see we have a huge number of boxes, imagine each one of these boxes as each one of the data collected for each one of the kids. Now, think about each one of these boxes have different sizes, colors, shapes. This is how difficult it is to explore, to do research in autism, because everybody's different, right? There is quite a diverse spectrum. So we use this mixed effect logistic regression model to either consider these random effects, which is the variability between each one of the groups and for each one of the kids across time, but also the fixed effects, which are the age, the sex, or the autism diagnosis, which are things that won't vary across time. So results for our analysis identify that if we compare the odds of having gross motor delay from the 24 versus 9 months of age, for the autism diagnosis group was the only group that was significant at that time. In the other jump of time between 9 and 54 months was significant for the 3 groups. And it was not significant differences in the change in the odds of having gross motor delay between 24 and 54 months. If we compare the children between two groups at each time point, we saw that it was only significant for children with autism concern versus those without autism at 54 months at the end of the analysis. And it was significant both at 24 and 54 months for the children who were formally diagnosed compared to those children without autism. And interestingly, we didn't find any differences between the children with autism concern and diagnosis. So this is not saying that the two groups are similar. What it's saying is that across time, there is no differences in the changes. They move across time. But we did find differences in the probability of delay for each one of the groups. Finally, the model was able to combine the two tables together. And what we see here is that from the jump from 9 to 24 months, we compare two groups. The only significant increase of the autism diagnosis group versus the non-autism was from 9 to 24 months. So this is saying if you look the same graph that we was before, if we compare the jumps from different time points, the increase in the jump for the autism diagnosis group was higher than the increase for not concern group, not autism group, and that was the only significant association. So in summary, we found that mother ethnicity, child sex, and gestational age were significant predictors of gross motor delay. This is saying that European mothers who were born, had girls who were born premature had more risk of gross motor delay compared to the other groups of children. That's in general. Also, children with autism diagnosis and concern have similar trajectories of gross motor delay across time. And again, we're not saying that these groups are similar. We're saying that they change similar across time. And also, we have to acknowledge that in our results, 61% of the children with formal autism diagnosis at 2 years, at 24 months, did not express a gross motor delay. So there's also a couple more research that is saying gross motor delay is not evident for all the children formally diagnosed. And also there is some variation across time for the early childhood in motor difficulty. So it can vary from 35 to 97%. And it will depend what kind of assessment was, and what level of necessities or support that each one of the kids they have for the severity, if there were other comorbidities considered in the studies. We also saw that the children with autism concern increased their likelihood of gross motor delay over time. So we do know there is some barriers parents for autistic children face when they're they're pursuing this formal autism diagnosis. We know there is a waiting list. We know that they go to referral. So I think that will be one of the causes. The other reasons. The other reason that I saw is that if we see that those kids that were formally diagnosed, I could compare those kids with those that were not formally diagnosed in terms of their interventions. We didn't have enough sample size for the autism concern group, so we're not able to see those differences that were significant. However, just doing a simple cross up, we did found certain differences. So I think we do need some more research in this area. And finally, by the time these children were formally diagnosed or had 4.5 years old, in 2013, there was just about to happen the DSM-5 update for the autism diagnosis criteria. So there might be also differences in the awareness in the both public and health educator sectors to help have an approach and achieve the diagnosis. Also, some implications for practitioners. So we know that gross motor interventions are relevant for the first year of life. However, according to these results, we should continue on this early intervention, not just for the first life, but also at least until 4.5 years old. They're also important to maybe we can change our investment that we do in each one of the programs that are doing for the practitioners that are currently working with autistic children. So we see right now that one of the professionals that are first in doing intervention with autistic children are behavioral specialists. However, in their curriculum, there is not formally trained in gross motor development, either milestones or typical development. So I think it will be important to also include that in their curriculum. So for parents will be just increase the awareness of potential any gross motor delay, and also what can do about or these barriers that are formal diagnosis to achieve the formal diagnosis. We have to acknowledge that parents are right being concerned about their kids being autistic, because gross motor delay will happen anyway, whether you have autism diagnosis or not. So I think we do have to acknowledge these barriers, and once we understand them, we can tackle them. For educators, I think we have to put closer physical activity programs to children, and the place that children spend most of the time is at school or daycare. So I think we have to include these motor training programs into these centers or into the regular education system as part of the traditional program. And also for policymakers. So we were not able to certainly identify how important is the gross motor assessment in this study. However, we do think that the expression and the report of gross motor delay should be part of the questionnaire that are screening for any kind of other developmental difficulties, so we can either assess and intervene all the children, not just those who have any motor specific development. So I don't want to finish this presentation without my future research. I wanted to use this image because this image is one of the images for part of the Trio Waitangi workshop that I was part of recently. And we were talking about the wave. We were talking about who will be the best person to ask about this wave, if the wave is what I'm thinking about doing my research about. So if I want to explore how the gross motor trajectories are compared to children with and without autism, and I want to know the effects these trajectories, and I want to know the effects of gross motor intervention have in other areas of development for autistic children. Maybe you would like to ask the person in the helicopter, you would like to ask the person who is in the top of the hill, but there's also people who are looking at the trees and they don't know the wave is coming. Or maybe the surfer has better information about how is the wave going, right? So I think my call today is just to be considered about different perspectives. So my future research is related to not only ask the mothers about concerns about their gross motor developmental delay, but also what do they think about it affects other areas of development. I also would like to study in future what is the perception of the children with autism have using the eight-year data collection wave about their physical activity levels, about their gross motor skills. The other thing I would like to ask is, I think when we do research here, we look at like different areas of development. So it's kind of, if you're doing research in one area, you kind of miss the comprehensive vision of what is happening. And what I want to do in future is ask the professionals who are experiencing on a daily basis the effects of this gross motor developmental training in other developmental areas. I want to know how do they focus on gross motor skills, what are their experiences while doing training, and what are the results of those training in other developmental areas. I don't want to leave this presentation without making a big thank you to all my supervision team. Thank you, Katrina Phillips, Lisa Underwood, and Karen Waldy for having all the patients with me across these ages. And thank you so much. Please, my contact email is para111@oaklanduni@ac.nz. Thank you so much.
Francesca?
Yeah. Thank you for the presentation. I have just a few questions.
Yeah.
The diagnosis of autism is quite difficult because really it's quite a wide spectrum. When you say the diagnosis being confirmed, reporting again from the parents was linked to
Medical
records.
Yeah.
This is one question. And then my question is, gross motor delay is really common in so many conditions. How much can be specific of autism?
Yeah, I totally agree. As parents, we tend to overestimate our skills development sometimes. And we do have some, I do have to make some note here because when parents says that their child might be autistic, we had to trust the time that they said they were diagnosed, the professional they said they were diagnosed. We were not able to we didn't have the data to cross those data and actually confirm that the kids were.
Is there other information in the data set that can help to really select the children who are most likely to have autism? So this is the way really to use a screening.
Yeah.
So apart the motor, I think is a question regarding in gross motor ability. There is any other variable, other information that can help to select the children that need more investigations and clinical investigation?
I mean, we could do the clinical assessment or we can do the more standardized assessment. If the standardized assessment we're using, we could use some difficulties of the relevant areas of autism, which is communication, social, and behavioral difficulties, and take all these kids and then do a later on confirmation of a diagnosis. But at the same time, children who are formally diagnosed by early stages, the average age of autism diagnosis here in New Zealand is 8. So all the kids that were before diagnosed, I think they were the most severe cases of autism. So we currently don't know what high functioning kids move. We don't know how girls move because most of our sample size were boys. So I think if you really want to select all the cases, we will have to embrace that maybe we will have some of the kids that are not 100% of the criteria of the standardized scores. However, they do have these challenges, and I would totally include the motor behavior on that.
I think information of, for example, feeding can be very relevant because feeding problem is not typical for autism by so much delay. So if you have also feeding problems, more likely you don't have autism, but you have
I know. Yeah, but at the same time, that feeding or any other kind of repetitive behavior, motor behavior that is repetitive, I think that's only like what I call the book standard autistic kid, which is usually a boy. But there's also another type of stimming or any other sort of times of that express girls or women that are autistic that are not necessarily bouncing or flapping the arms. So, for example, I could have an increase in blood pressure. I can put my face red. I can squeeze my arms so quite, and that usually is not a screening approval for autism. So all these other not both children are totally excluded for this sample size. So I think one of the strengths of this study is that we, although acknowledge that we did not only use the formal diagnosis kits, the reason for that is because we have all this previous research that is saying we are not including all of them. And one of the ways we use to overcome that is accepting the parents' concern as part of our research. And we actually didn't combine the two groups together. We wanted to keep them separated because we still found some differences. The other thing that you said at the beginning is that motor behavior was not specific about autism, and that's correct. You will see other motor developmental delays in other conditions as well. Could be a part of neurodiverse groups or not, right? But at the same time, what I like about motor behavior is that it's easily assessed by visual exploration. So you can teach a mom, you can teach a professional, you can teach a school teacher how to identify which are the milestones that has to be achieved and what is the specific timeline for that. So I think the gross motor delay, although it was not described in this research today, we did found some retrospective studies in autistic children when we combined the two groups together, children with autism concern and diagnosis, and only for those autism diagnoses with formal diagnosis, we did saw that having autism has 2.6 more times to be, having a gross motor delay was 2.6 more risk of having an autism spectrum disorder diagnosed at 24 months, which is quite early. We usually have other communication or social skills that are actually more evident for parents because the child is actually in the school system. So the teachers are like, oh, your son is not talking, or or is having difficulty socializing with other kids. However, at 24 months, you mostly don't require that kind of society requirement. You're not stressed by those requirements, the social requirements at 24 months, but you do are for motor behavior. So although it's not mandatory to have autism, if you have a red flag of motor delay, we do think it's a good red flag. So every kid who is gross motor delay at 24 months has to be screened at 24 for having autism diagnosis or later on.
Yeah.
But and we do have this window from 24 to 54 months where we did find significant differences. So I think, and also consider that the not autism group was everyone. So if we only consider the typical development kids, those numbers will expected to be even higher. And I forgot what I wanted. Maybe another question you said that I didn't respond. But those are very good questions. I think it's a very in the discussion right now, how relevant is the gross motor development for children with autism, and not just fine motor skills, which are writing, handwriting, right? Because gross motor development will, if you walk, if you sit by yourself, if you go and climb, you will be more able to access other learning opportunities, other conversational groups, but if you're not able to very early on to move appropriately, where are your other learning opportunities will be? Like you will rest all those other windows in a very early on before 8 years old, which is very relevant. Yeah.
So what you're finding, Paula, is that something is going on between when children, we don't have the precise timeline, but something's going on before children reach the age of 2, where we're seeing differences in gross motor.
Yeah.
From a practitioner point of view, how does that look? What do kind of interventions look like for children of that young, like under 2? Yeah. And as a practitioner, how do you do you adapt those interventions if you think the child has autism? Like, are there different approaches?
Yeah.
Depending on that?
Okay, for the first question, somewhere between 9 months and 24 months, it happens, this more risk of having autism and having a gross motor delay will be related to autism. So at the 9 months, I think the milestones, the gross motor milestones that were considered for that data collection wave still didn't include walking, because 9 months, you're not expected to walk. You can have children that can able to stand up by themselves, have a little steps, or going through steps helping themselves with the surfaces, right? However, I think my next part of my study will be to identify which are the actual milestones that better predict with our autism, because I think we need to include those milestones, either the screening and the training for motor skills. And the other question is about how different will be motor intervention for children with and without autism in the very early stages, like before 24 months, right? So I think the first difference that we have seen so far in the research is the type of learning opportunities that we offer. So we are considering that if you access to something that is attractive to you, I think your brain will want to be part of. The difference with children with autism is that we have to make sure what are the special interests for those kids. That's why we attract attention, and attention is the most relevant requirement for learning. So, and then comes memory, and then comes repetition, right? But before that, I think we need to tackle in the assessment, in the interview for the parents, what are those things that are more attractive to the kids? Is it color red? Is it Spider-Man? Is it like is it jumping in the trampoline? So I could use those interests on my favor as a practitioner to achieve other developmental skills, because I know this developmental skill will in future help communication, cognition, and social development. And that's also part of my next step in my research. So to explore what are the effects of this motor training at very early stages from 2 years until 8 years old. So I really want to know what is happening, and those interventions are only performed by practitioners. So all the parent mediated interventions were excluded. I want to very specific. I didn't have too many numbers, but I think we hope to publish that very soon, hopefully.
Yeah, I think that's a real sea change we're seeing in autism intervention, where in the past it's always been about stopping children from doing certain behaviours.
Yes.
And it's moving now towards understanding why children are doing certain behaviours and
Yes.
using their
on your favor. Yeah.
In your favor to
Yes.
stimulate growth,
Yeah.
like stimulate development. It's a real difference in how we see.
Yes, we do
that
have to acknowledge that certain behaviors that are, for example, punching is not socially approved. It doesn't, we, our society, has to be very empathetic and with autistic children, but I don't have to receive a punch because that is not appropriate, right? So we do have to learn how to tackle behavioral challenges, as for example, punching. But at the same time, society has to be flexible about, okay, if we say a kid flap with our hands, what's the problem with that? How is that affecting you? It doesn't. It is not. So we have to kind of normalize all these social perception of, and instead of that, moving forward to what is the kid able to do, and from that move forward, Yeah, that's my proposal for today.
Have a further, maybe a discussion part rather than a question.
Yeah, sure.
You talk about future directions of something about perceptions of the child as they age, because I think that when you do, I'm sure you know this, with disability research, you want the perceptions of all stakeholders, including the person themselves.
Oh, yes.
So how are you?
How would you do it?
More about
Yes, I mean, the only type of items that we have related in the 8-year data collection wave is related to the perception of the child about their physical activity levels and how confident and comfortable they feel while they're performing it. But I think we can kind of do there is this late in class type of analysis that is usually due for identify results for things that are underlying as the perception of the kids. So I think I will have to use another kind of analysis, not the same model, and also there is no qualitative information here. I don't have their actual expression about what they feel. So it will still be a quantitative analysis, and I will probably use some more simple analysis like an ANOVAs to compare what different means. So these scores they're replying for.
Yeah, I think there's two things. One is we've got some objective measures in growing up in New Zealand of development, but we also have, especially at 8 year, a lot of subjective measures. So I think the ones you're talking about, Paula, are the Harter's self-concept scale, and that's in different domains about how kids can kind of understand or feel about whether they're good at academic work.
Oh yes.
And I think those are really, like, obviously it's not qualitative data, but it does give us an insight into how the kids feel about themselves and the way they interact and the way that they perform.
And also in future, we can also use the 12 the data collection way. I think we can move forward in terms of, okay, how big their kids are right now, and look back. There is also some accelerometer data too that we can cross information from that. This accelerometer is a device that you can put on your wrist, so you can measure how much physical activity you're doing during a day. So you can cross this quantitative with this kind of self-perception information and maybe see what we found there.
I almost wonder, taking it one step further with that, of like, how does that child's perception go on to predict or maybe retroactively?
Oh yeah,
certain,
yes, that's another
like,
research
what is
question.
the impact of the mindset the child has on
Yes,
earlier?
yes, certainly. I think we will have to control for Lord the cognitive conditions that maybe some of them have. I would have to identify what other developmental delays they have, so make sure they understand the question by the time they were asked, and also what kind of interventions they have had before 12, something like that.
There's also time use diary as well that will have a lot of information about physical activity and what kids are spending their time doing.
Yeah.
Be confident there.